Yeah, so quickly, I just want to kind of show everyone what it's like to do an injection. I have a penis model here. So essentially what is required is some sterile alcohol wipes that are used to cleanse not only the penis, but the vial of medicine that's used to be injected. So what we also need is a very small syringe with a needle that is kind of hard to see. It's so tiny, but it is a very reasonable size needle for especially even men who are very scared of needles. So first off, the vial of medicine comes like this. I clean with an alcohol swab the top of the vial just to make sure there aren't any bacteria there before I begin to drop the medication. Patient's doctor will recommend a dosing based on his response to the injection medicine in the office. So we just invert this and pull back the intended amount of medication. And then on the penis, so important to think about where to inject on the penis. So on the top of the penis is where the nerves and vessels are, and that is not the right place to inject, nor is the underside of the penis where the urinary tube or the urethra runs. So essentially when looking at the penis, on the sides, in the 1 and 3 o'clock position is where injection should occur. And I always counsel my patients that it's important to make sure that you alternate sides for injection to decrease the risk of fibrosis. So here what we would do is prepare the penis and the penile skin with a alcohol prep pad. We would look on the penile skin. Obviously on this model there aren't any veins visible, but on most men you can see superficial veins, and I would avoid injecting in those areas. Then we would take the needle in an approximately 90-degree fashion and insert it completely into the corporal body, inject the medication in by depressing the plunger. We would remove the needle and apply pressure with either a gauze, or you can even use the alcohol pad again in order to stop bleeding from that spot, especially important in men who are on anticoagulation medication. And that's simply all that's needed in terms of performing a penile injection for intracavernosal or ICI. Now moving on to the penile implant. So quickly, in the interest of time, so we can get to more questions. This is a model of the Boston Scientific penile implant. This is a silicone penis with simulated testicles here. On the bottom, let me raise this up so everyone can see. There are testicles here and a pump in the scrotum. So essentially what we would teach the patient to do after a penile implant is learn how to pump the pump, which is here in the scrotum. And we would show the patient and or his partner, if he would like to involve his partner in the process, on how to squeeze the pump, which is then moving fluid from a reservoir, which is simulated back here, which would be that salt water containing reservoir up underneath the belly muscles, completely hidden from view. And every patient's anatomy is different, so the size of the implant is different. It's customized to the patient. We always try to give the patient the maximal size implant that his body will allow. So the number of pumps required to inflate the implant can vary just based on the patient's anatomy. But as you can see here, while we're talking, within just a few seconds, we've taken the penis from a flaccid state to a fully erect state with good rigidity in the penile shaft skin. Once the patient and his partner is satisfied with the intimacy, the patient then will grasp the deflation button and hold that, which allows the valve to open and moves the fluid back into the reservoir. This process can be expedited by the patient also with his opposite hand grasping the shaft of the penis and applying gentle pressure to encourage the fluid to move against gravity back up into the reservoir in the abdomen. But all in all, as you can see, even though this is a simulated anatomy figure, the penis with the implant inside, really without anyone knowing it's there, it's very well concealed and it looks very natural.